Hello everyone, today I'd like to share some tips on daily health care for children. Common issues in children's daily health care include fever, colds, and a runny nose. Additionally, indigestion can occur during the eating process. In daily health care, we can opt for daily techniques such as massage and acupressure to help avoid frequent visits to the hospital and enhance the child's immunity. Today we are doing daily health care for the little ones. One of the common issues we encounter in daily health care is that children often have a weaker spleen and stomach. Let me explain a common manipulation. The first manipulation is to strengthen the spleen. Find the child's thumb. From the tip of the thumb to the second joint, this area is associated with the spleen meridian. The side is the spleen meridian, and the inner side is the stomach meridian, so it's important to distinguish between them. We need to find the correct location, which is a line along the inner side of the thumb. From here to this position, when performing the manipulation, you might choose to use baby oil, flour, or talcum powder at home. These are all fine and mainly serve as lubricants. After applying the lubricant, since young children are generally small, we usually use the second and third fingers to hold their wrist joint to prevent the child from moving, as movement can harm their wrist. So, when doing this at home, you can use your index and middle fingers to hold the child's wrist joint, while the other hand holds the thumb, the area where we will be working. Then, use the other hand to rub. For children, health care is generally centered on rubbing, but always in a single direction. The direction I'm doing now is toward the heart. What does that mean? It means pushing from the fingertip toward the heart. This is the method to strengthen, not to move back and forth. We choose a single direction, pushing toward the heart. During the process, we aim to achieve about 400 strokes per minute for a 5-year-old child. We can rub quickly. Remember, always in one direction. This is to strengthen the spleen meridian. Children can have this done daily. As we rub quickly, the surface of the finger will quickly warm up due to friction. Remember, don't press too hard, just rub gently. Try not to rub back and forth. Another point is that you can use either hand. This manipulation strengthens the spleen, and its characteristic is that it moves toward the heart, along the inner side and outer edge of the thumb. The second thing we do is clear the stomach meridian. Clearing the stomach meridian is done on the inner side of the thumb, near the base of the finger. It involves massaging from the finger joint to the fingertip, which is the technique for clearing the stomach meridian. This direction is away from the heart. Earlier, we pushed toward the heart, but now we are pushing away from the heart. The direction is determined by the manipulation of dispersion, as clearing the stomach meridian is a dispersion manipulation. We push away from the heart, moving inwards as we perform the manipulation. This method can still be applied. Nowadays, children often have improper diets, frequently snacking and eating lots of fruits. Parents tend to habitually supplement their children's nutrition. At this point, the child's stomach burden has already increased, so we can perform this stomach clearing manipulation for them daily. Similarly, we hold their joints and rub, moving in one direction only. However, this manipulation pushes away from the heart. These are commonly used acupoints for daily health maintenance. So when you're with your child, like when they're reading or studying, parents can perform this manipulation at home. In pediatric massage, the typical age range is from 0 to 7 years old. For children aged 4 to 7 years, the manipulation is generally done about 400 times. For those from 0 to around 3.5 years old, we usually choose to do it 200 to 300 times in one direction, doing 200, 300, or 400 repetitions. This is the stomach clearing manipulation. Clearing the large intestine meridian is done along the side edge of our index finger. It extends from the finger joint at the base to the fingertip, which is the large intestine meridian area. When we think about clearing, it's generally done by pushing away from the heart. Only when tonifying do we choose to push toward the heart. This is the large intestine clearing. For children with irregular bowel movements or constipation, we can use this manipulation. For children over 5 years old, some techniques can actually be taught to them. When they perform it themselves, they can simply slide their hand downwards. For younger children, we should remember to hold their wrist joint. Our hand movement remains in one direction, pushing away from the heart. This is large intestine clearing. For cases like a cold, we should perform this large intestine clearing. For children over 5 years old, we still choose to do it 400 times. This is large intestine clearing. Clearing the liver meridian is also done along the index finger, from the second finger joint to the fingertip. We hold the child's index finger with both hands and perform the movement 400 times. The direction is also away from the heart, pushing in a single direction, away from the heart. The index finger is for clearing the liver meridian. The middle finger is for clearing the heart meridian. It's also done by pushing away from the heart, from the second finger joint to the fingertip. It's performed on one side, 400 times. Our fourth finger, ring finger, is for clearing the lung meridian. It's also done from the second joint to the fingertip. This is for clearing the lung meridian. Currently, children often have low immunity, so we might perform this lung clearing technique more frequently. It's also done in one direction only. All clearing manipulations are done away from the heart, with a unidirectional push. Remember not to move back and forth. This is also done 400 times. The fifth finger corresponds to the kidney meridian. There are two methods to strengthen the kidney meridian. Rub from the second finger joint to the fingertip. This is for strengthening the kidney. We push toward the heart with a single-sided push. Another method is to press and knead at the fingertip. After pressing, knead 300 to 400 times. This method can also be used for adults and is faster for strengthening the kidney. Press at the tip of the fingertip and knead. There is no clockwise or counterclockwise, just knead. For those who want a quicker method, you can also use fingertip stimulation and pressing. To recap, we have discussed a total of 7 meridians: spleen meridian, stomach meridian, large intestine meridian, liver meridian, heart meridian, lung meridian, and kidney meridian. All are on our hands. To make it easier for you to remember the directions, when we turn our hand like this, it forms a 6. For the thumb and the fifth finger, generally, the direction is toward the heart, for strengthening the spleen and kidney. For the index, middle, and ring fingers, the direction is away from the heart, for dispersing. This should help with recording the directions.